Dr. Becky Cooper.
Thank you, Chair, and thank you, Sir Julian and Mr Dilks, for being here. I would like to ask you both about the Department of Health and Social Care as a sponsoring body for the CQC. So, Mr Dilks, if I could come to you first, could you please tell us how that support has been for the CQC and for yourself, and perhaps any areas that you would like to see improvements moving forward?
Well, thank you. Interesting question. Clearly the last few years have been challenging with changes of government or personnel. The department just at the moment has been taking advantage of a new chief executive coming and things they do, been very supportive, a number of discussions. We meet every couple of weeks. But I suppose I would, if I'm completely honest, would say a little bit surprised by the extent of contact I've had with department, particularly at ministerial level. You may know I chaired another public body before for 7 years, and I was used to seeing the sponsoring minister periodically, and I did also meet the Secretary of State on a number of occasions. That hasn't happened in the last few years. Now, it's two governments, but I've had 6 Secretaries of State and I think 3 sponsoring ministers that time, and I haven't actually...
Sorry, Mr Dilks, just to be clear, the previous 2 governments, you haven't had regular interaction with the Minister or the Secretary of State?
No.
Okay.
And one of the reports, I think Penny Dasher's report did refer to it, and there's oversight in the sponsorship, and they're related because you have the same meetings. But I don't wish to be critical, but I have to say, having been used to chairing another body where I had those regular meetings, I'm a little bit surprised that I haven't had the same engagement with the ministers here, and I think that would have been helpful.
And Mr Dilks, did you get any sense as to why that was the case?
No. I could speculate, but I won't.
No, that's fine. And any other
the other point I would make, if I could, so there were 2 things, but the other I've already touched on, that speed of response. The fact that we know there's an issue across government. This isn't us or our sponsoring team. You've sure all seen the NAO report at the speed of putting directors, but we were in danger of not being quorate as a board at a pretty critical time. So waiting 9 months for a cohort of NEDs and waiting 14 months for a chair of the audit committee. Was that the cause of the problem? Absolutely not. No, don't be clear. But it would have been helpful. If you assume that having a good board is a good thing, yes, then it would have been helpful to have been in place. And the same thing applies on approval for pay scales. We have a huge degree of independence, but one thing we do need to do is get approval for posts at a certain level. The department was very helpful in giving me approval for the salary level we felt appropriate to recruit Julian. We got that by the beginning of September, and we were able to run that process that ended in 4 weeks. That was great. But I could give you other examples where we've been waiting for a very long period of time, and the Chief Inspector of Hospitals would be the obvious one. We have a vacancy there for over a year now, and we're just beginning recruitment. So I think that would be... as the outgoing chair, I can say that I think speed of response on key issues would be very helpful.
Just before I move to Sir Julian and ask a similar question, I just want to clarify, were you seeking meetings during this time that you needed? Were you seeking responses and just simply not receiving a response?
Right.
Okay, thank you. Sir Julian, I'm sure none of this is coming as a surprise to you, but I just wondered, with your incoming sort of appointment,
yes,
what your reflections are of the relationship currently and what you hope for going forward.
So my experience in starting in the role has been very positive in relation to engagement with the Department of Health, quarterly accountability reviews, budget and assurance meetings, fortnightly recovery meetings with senior colleagues in the department, fortnightly policy and engagement meetings, and regular one-to-ones, and the opportunity to speak with the Secretary of State. So I feel that I have a positive and engaged relationship with the department. It's clear to me that their expectations of me and what we as a CQC do, they're very, very clear about the need to address the issues that we've discussed today, and they are having, in my view, the appropriate conversations about those issues, and indeed looking to support the appointments that we want to make that I've described around those chief inspectors.
Great, thank you.
Can I just say, I think, phrased the question slightly differently. Let me be clear. I have a very good relationship with the people I deal with day to day in the department, and I've already extremely grateful for the speed they responded to approval for recruitment with Julian. So we gave slightly different answers, but I was asking a question about what else could be done.
No, very clear. Thank you, Mr Dilks.